First of all, by way of intro, I'm Matt. I work for Symetri. I'm part of Richard's team. So the topic of this session is securing funding through the Health Infrastructure Plan, and then subsequently delivering to a BIM compliant project. Just heading over to our panellists. Chris, if it's okay, I'll start with you. Obviously, your trusts are on the latest HIP plan, 2025. So it'd be really useful, I think, for everyone in the room if you could just speak to the process that you had to go through to achieve that funding, but also what some of the common challenges or challenges you experienced through that process.
That's a really difficult question, but a simple question in one way. So, and there is no simple answer other than to say one of the reasons we're on the programme for a number of reasons. One of those is to do with our significant backlog maintenance, and through the development of the NHP programme, of course there's 14 there at the moment, hospitals with a further 8, and there's going to be an announcement on some more. So that's been not, and I think there's another colleague in the room who's actually in that programme as well, so it's been quite a complex process, and it doesn't end, it's iterative. So we've had lots of conversation with NHS EI colleagues originally, before we became the national, the NHP team. That has, like I say, still evolving to this day in terms of what does our programme look like. We've got 2 hospitals with the programme, and actually we'd like to add a 3rd. There are all sorts of questions around, latest standards, and clearly for those in any of the NHP projects, you'll know we've been asked to provide digital twins, digital renovation, single bedrooms, all sorts of different things. So probably give you a better answer if you spoke to me separately for about 5 minutes, and I'll try to explain how we got onto that programme and all of the challenges. It doesn't stop when you're on the programme, it continues actually. I probably don't answer your question in its entirety, because I could spend half an hour talking about it.
Yeah, it's a comprehensive process, and there's so many details to it.
Yeah, and
it doesn't end.
It is iterative. It absolutely is iterative, depending on what way you're on as well.
Okay. And Richard, I think, is there anything you could add to that from the Symetri perspective, working with the trust that we've been involved with, and some of the challenges that we've encountered, working with the likes of Milton Keynes?
Yeah, I think from a BIM compliance point of view, the trusts have been left a little bit to themselves. I don't know if you've experienced that, Chris, in terms of getting guidance. You've got 1,000,001 things to do as an estates director, and knowing about BIM standards and how to deliver a BIM compliant project is undoubtedly not at the top of the list, let's put it that way. So from a Symetri point of view, we've worked with trusts and tried to help as best we can, but as I've said previously, I don't think delivering a BIM compliant project is the be all and end all for NHS trusts, and they should be really taking the opportunity to shape their digital strategy as part of the need to deliver a BIM compliant project. Why not get the data you actually want rather than the data you just have to tick a compliancy box? And that's the challenge we always push to trusts. So we don't necessarily make your lives any easier, unfortunately, but at least you get value out of the work you do.
I suppose drawing on that, we're talking about what data you get out of it. And Baroness Ilora, you touched on earlier, in the Groningen example, collaborating with the whole city, trying to get that information. As a medical practitioner, if you're imagining yourself walking into, let's say, a ward, what are some of the things that you think might be missed from a data point perspective that we need to make sure we're implementing or getting in a model when we have a new build hospital?
Well, I actually would like to it's not to duck your question, but I'd like to go way back earlier, because I found it really interesting sitting here, because I'm not in the construction industry, so I'm just looking at it from the point of view of having done a select committee and knowing a bit now through experience of working with a vast quantity of civil servants. And as somebody said, you don't know what you don't know, and you have to remember that you know the world that you're in, just like I know my world in medicine, but the people that you're interacting with know absolutely nothing about what you do and where you're coming from. And today's been really interesting, and I was trying to think, okay, how can you get something out of this to move the whole process forward? And it strikes me that within this room, there are huge numbers of people with experience, and you all know the mistakes that you've seen happen. And I would put money on it that many of them are the same mistakes over and over and over again. So the mistakes get made recurrently. You each have this library of mistakes in your head, but they've not been collated. And I want to throw a bit of a challenge down to you, which you might not want, and you didn't know it was coming. I guess it's going to be principally to you. And that is that you actually, out of this, and I might be able to help a bit through the Bevan Commission in Wales. We might be able to do some work with you on it. But that actually you document very simply the recurrent mistakes that you've seen made, because somebody called for parameters and a checklist. And I think if you were able to have that just freely available, so civil servants looking at projects that come in would have got a collated view of what are the things, the checklists that they should be looking for in projects. Because the problem with this phrase BIM, it's been captured as, oh, that must be the solution to the problem. It's a bit like people talk about antibiotics as a solution to infection without realising that the vast majority, A, are not bacterial, so antibiotics aren't going to work, and B, there's antibiotic resistance they've got to cope with. So it's about providing them with something that's a checklist, and for the people actually working in the NHS, who the trust board and the trust management go to as their go-to person. And many of you are in the room from just chatting to you a bit, you seem to be. And so co-produce a baseline document. And then the other thing is about keeping it simple and recognising and validating the emotion. One of you used the phrase metaverse. Well, is metaverse just a fancy name for emotion, for what you feel? You walk into an environment, you ask me about walking into a ward, I will walk in and think, no, this place is miserable. Yeah, or actually, these staff seem motivated. You just look round, you see a bunch of nurses sitting at a nurses' station on one ward, and you think, whoa, what's going on here? And you go to another one, and you see them working with care assistants, with other people in different patient rooms, and you think, okay, this place seems to be working well, what's making it work well? But it's that gut feeling. You look at people's faces, and you see from their eyes that they are motivated and alert, or you see from their eyes that they are just demoralised and fed up and worn down. And those are the pointers that you need. I mean, you can put the word metaverse on it, but I prefer to call it emotion because I'm a bit simple on these things. And then I think if you've got your checklists there, you're then saying to whoever's commissioning something to be done, we're going to help you solve the problem before it happens. We're going to be there. This is like preventive medicine. It's exactly the same. Why did vaccination matter? Because without vaccination, probably a quarter of people in the room would have been dead with COVID. Looking round, you know, I won't go finger pointing, but I can look at some of you and think, you probably would have died with COVID because of da-dum, da-dum, da-dum. Okay? Sorry, clinical eye. You can never stop having a bit of a clinical eye. But the group that you're talking to are the civil servants who are advising the ministers and advising into Treasury. Treasury only know one word, and it's got 2 letters in it. It says no. Most of the civil servants only know one word, which is also no, because they've learnt that coming down through the system. And then somebody comes along and says, oh, well, we've got to have a kind of flagship project. So let's put a bit of money out there get everybody to bid for it. Now, I will be quite honest about bids because I can say what I like, but perhaps you can't be quite so honest. But I've seen situations where people say, oh, there's that money, we must go for it. What can we bid for? What do we need? So it isn't that they've said, for 5 years we've been desperate to do this, at last we've got this plan worked up that we can take forward. It isn't. People scrabble around and let's get a bid in, and you know that the people who win the bid are the people who know how to write the bid document. They don't necessarily have the best project. And why? Because they've contracted in some consultant who knows how to write the bid document for them. But if you actually want to be adopted across the piece, you've got to make life easier for people. You've got to solve their problem before it happens, and you've got to communicate with them in their language. And one of the problems of the tech language is it's a language which is new and strange and scary. So you are talking to them in Chinese. Now, is it Mandarin or is it Cantonese? Oh, who knows? Come down with me, you'll try talking to them in Welsh. That's really difficult too, and there's no tech language in Welsh. But you've got to adapt what you're presenting to them into their language so they can understand it and they can see how this will solve their problem. Because sitting here, for me, it's been an eye-opener. So I've actually enjoyed being here. I've even skipped a meeting to stay on here now, and I'm going to have to run out the room in 2 minutes because I'm meeting with the Ukrainian ambassador online in 2 minutes' time. So I'm not walking out on you all, it's just that I do think that's rather important. So that's my little summary, really, of where you go from here. But I think this has been fascinating, and I would just put a plea out to you. Don't stop. Make this meeting the beginning. You've got a bunch of delegates here. They've got masses of information in their head. They're the most fantastic resource. Pull them all together, pool it, because you need to be moving this world forwards, and you can do it.
Is that the answer you're looking for, Mel?
I think that's answered every question I had written down. So.
Oh, okay. Sorry about that.
I think
I was so motivated, I even took notes.